Welcome everyone to today's webinar, Adulting 101, Navigating Healthcare as a Young Adult, led by Rebecca Morse. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to Rebecca for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. At the end of the session, your questions in the chat will be used to moderate our question and answer. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for being here. I'll now pass the workshop over to you, Becca.
Hi, thank you. I'm glad to be here. I am going to take us through this presentation today. I think we'll start by just talking about the agenda. I'm going to introduce myself and tell you a little bit more about myself. We are going to talk a little bit about what a young adult is as a definition. And we're going to start talking about what legal changes and, just physical changes that happen when you turn 18. We're going to talk about some strategies throughout today for managing your own healthcare independently. So we're going to be discussing making appointments, dealing with health insurance, dealing with the pharmacy, some general resources to help you with this process. And then we're going to have some time for question and answer at the end. So please feel free, like Sierra said, to put any questions into the chat. If you're watching this recorded afterwards, I'll have my information at the very end of this program. You can always reach out to me directly if you have additional questions and, if you want thoughts about anything. So, like I said, my name is Rebecca Morse. I am a social worker here at Dana-Farber. I work in our Perini Clinic for pediatric survivors of cancer. So patients who we see in our clinic are of all ages. To be seen in our clinic, they've had a cancer at some point in their life. So we see people all the way through the lifespan. And one of the things that comes up quite often for us in our clinic is that we have patients who had cancer when they were young and had a ton of medical needs throughout a huge part of their life, and now are starting to learn how to manage those needs independently. And that's a process that happens for most people. When they turn 18 or as they get older, they have to start learning how to manage the process independently. What's unique about people who have or have had cancer is how many pieces of the system you are now expected to navigate, and it can be really scary and really overwhelming. I also know that we may have parents or caregivers of young adults who also watch this. So I'll be addressing this towards young adults, but I'm hoping that the information will be salient to, anybody who is at that age and in that journey. So I'm going to say this many times through this session that this is a lifelong learning goal. I'm in my 30s and I am still learning how to manage my healthcare independently. It is a really complicated, difficult system, and things are always changing that are outside of our control, especially as patients, right? So what I want you to know is you don't have to get all of the information from this session right here. I'm hoping you can come away with some strategies for managing your care and for how to talk about it with your providers, with your family. And really, if you take one thing away, I want it to be that you can do this and that there are supports there for you as you start to figure this out. I want to acknowledge that this can be an overwhelming subject, so please take breaks as needed. If you're watching this as a recording, pause it, go walk away, take a minute and come back to it when you're ready for it. And just know that your medical team is going to continue to be available to support you as we talk about this. So we're going to start by talking about what is an AYA. That is a term that you may hear thrown around a lot during your medical care. It's a term that refers to adolescents and young adults, and typically is defined as ages 15 to 39. And it's a time in your life where you're encountering a lot of firsts and a lot of new things, no matter where you're at in your health journey. So people who don't have, cancer or chronic medical needs are also experiencing turning into a young adult. One of the things that we find often is that people who have had highly medicalized childhoods and young adulthood are missing some of the key times when they would be having first if they weren't sick and in the hospital, right? So we see that a lot of people are, maybe not being able to get their first job at the same time as their peers, or go to prom, or date, or learn some of these early development things that can teach independence. We also see that people who are affected by cancer mature in different ways, and sometimes totally out of the scope of what somebody who isn't going through this would experience. So we see some levels of greater independence, of greater knowledge of the medical system and of managing healthcare before your peers may get there. So you are at a time right now, if you are an AYA, you are navigating social dynamics and you're exploring your own independence and autonomy. And what we usually see with people who are in this population is that this is a really big time of identity formation, of figuring out who you are in the world, what you want to do in the world. And taking those first of going to school, getting your jobs, those first, career challenges that you might face. So this is a really under-resourced population too, medically. And we want to, bring awareness to you as a population that you have different needs than somebody who maybe is older and has navigated the medical system for a few years before entering into cancer care. And, you have a significant amount of resilience that you bring to this process. So I really love this quote. When we learn to become resilient, we learn how to embrace the beautifully broad spectrum of the human experience. Now, as a as a thing that has happened in your life, cancer has brought resilience. And the reason I am leaning into this right now is because I want you to really know, as we go into talking about some of these bigger, scarier subjects, that you already have developed problem-solving skills, self-advocacy skills. You're already really prepared for this transition to adulthood. And there's a huge importance in trusting your instincts and using your voice in healthcare settings. Okay, so I'm a resilient, awesome, and overall fantastic human being. How do I actually adult? So let's get into that. So a question I get a lot from people who are about to turn 18 is, what is going to change? So some of the ways that I talk about this is, as an adult, you will have the right to consent to medical treatment or refuse it. This means that you can make decisions about your healthcare, including choosing your own doctors and treatment options. There are some exceptions, and those are such as in cases where you're not able to make decisions for yourself due to a medical emergency. You also will likely be transitioning this change from pediatric providers to adult providers. What comes up a lot in Dana-Farber is that we have patients who stay with us throughout the lifespan. Some of your doctors will change and some of them may stay the same. So some of the things that happen at your doctor's appointments will change too. So you may stay with some doctors, you may move on to some new ones, but it's not going to happen all at once. For example, most people grow up having a pediatrician, so somebody who that they meet with for annual exams throughout their childhood. When you turn 18, some patients, the pediatrician will say, okay, you are ready to move on to an adult doctor. Sometimes the pediatrician will say, listen, I want to hang on to you for a little longer. And that can vary person by person, but usually we see it around, if somebody has very complex medical needs, a pediatrician might want to hang on to you until you're through college and help you kind of transition. If you have medical needs that are more frequently addressed in the adult world, your doctor may transition you earlier. This is a conversation that you can have with each of your doctors over time. And I would really encourage having that conversation sooner than later. We encourage starting that conversation around age 14 or 15, saying, what do you expect in the next couple of years? Do you expect that I'll be staying with you or moving on to a new provider? So change is scary, and I believe you're ready. I believe you've been preparing for these changes for many years, and you might not even realize it. And you are the expert in you. Showing up is 90% of the battle. So, what I mean by that is you may be showing up to new doctors, new places, new medical experiences. You don't need to have studied anything to do that. You don't need a textbook to do that. You just need to bring yourself and be able to report to your doctor what's going on with you. And it's your doctor's job to ask those questions and to find out what you need, right? So all you need to do sometimes is show up and then let it unfold for you. And you are not alone in it. You have us here to help you navigate your healthcare. And again, we've already talked about this, but it is a really confusing system for many people. There are a lot of moving pieces, so you can always ask for clarification or for help. Another question we get a lot. Do you mean I have to make my own medical appointments? And yes, at some point you do. Until now, your parents probably manage most of your health needs. And now, as you become a young adult, it's a good idea to start learning how to do those things yourself. So, some tips for that. I want you to practice, and you can start by listening to somebody who you trust make an appointment. So maybe you're 17 and you know that it's going to be time for you to start making your own medical appointment soon. So perhaps having, your mom or whoever usually makes your appointment call, and you can listen in on that call and maybe take some notes about what does mom say to this person when they first pick up the phone? How does mom handle that phone call? And I really like the idea of writing a script to use when you call, something that you can rehearse. If you've ever been in the line at Starbucks and thinking about your order ahead of time, it's that same exact mechanism. So instead of saying, I want a venti mocha frappuccino with light ice or whatever, you're going to say, hi, I'm Rebecca. I'm calling because I need to make a doctor's appointment. And if you get stuck in that, you can always ask the receptionist, what do they need to know? And I think it's a really good idea to enlist a parent or a friend, if you're nervous, to be with you when you make the first phone call. So maybe you start by listening to mom or dad make a call. And then the next time you make the call, but you have mom or dad right there to help fill in any background information that you might need. So here's an example of a script for talking to a front desk about making an appointment. So receptionist says, thank you for calling Dana-Farber Cancer Institute. How can I help you? And you can say, hi, I'd like to make an appointment with Dr. So-and-so, please. And receptionist would say, are you a new or existing patient? And you're going to say, I'm existing. I've been here before. Receptionist says, what is the reason for your visit? Now, you might be calling to make an annual visit. So you might say it's my yearly checkup or I need my annual visit. You might be calling because you have a symptom. You can say, I'm having a symptom that I need to be seen for. And the receptionist will ask as much detail as they need. You don't have to go in and tell them everything all at once because they'll ask you for those details. The receptionist is going to ask, do you have a preferred date or time? So it's really good to come with your calendar ready and a couple of times that might work for you already laid out. Sometimes if you're scheduling something, you're going to be scheduling something 6 months or more out, depending on the type of doctor that you're seeing. So it's really good to have an organized place where you can put that. And they're going to say, we have date and time available. Does that work for you? You say yes. I also want you to write it down in your calendar right away so that if it is in a few months, you don't forget it when it comes up. So you've made the appointment. What are you supposed to do? So let's say you're about to go to a doctor's appointment. What I want you to do is come up with a list of questions that you're going to bring to that appointment. Those questions can be things like, I'm having this weird symptom and I don't know what to think of it. It can be, this is the medication that I'm taking. Am I taking it correctly? Anything you can think of, you can put into that list of questions, but it can help you when you're in the setting where you might be feeling a little bit anxious or things might be moving quickly to be able to say, okay, I have my agenda. I have my list of questions that I'd like to talk about. I also want you to bring a list of the medications that you take. Some people find it easier to just take the bottles of their medications, put it in a big Ziploc baggie, and bring that with you. But I want you to be able to speak to what is the medication and what is the dosage so that when you show up to the visit, you're not scrambling for that information. It can also be really helpful to ask your parent or caregiver about your medical history, especially if you are somebody who had cancer when you were young and you might not have a full memory of every treatment that you had and every medication that you were put on. It can be really helpful to write down some of this and to be able to bring that, especially when you're going to see a new doctor who might not have a history on you. So some of the key points to write down are, what was your specific diagnosis? What year were you diagnosed? Anything major about treatment that you can tell the doctor? Those are all helpful things to bring. And I know that can be really daunting when you've had cancer because the treatment is so extensive. So writing it down, it can be something you write down over time. You might put down a little bit of it today. In a couple of weeks, you revisit the conversation, you add a little bit more. I think it is always helpful to bring a support person to a visit if it makes you feel more comfortable. And I think it is important to spend some time alone with your provider. So having that balance of how much time do you spend, with somebody who is your helpful support system, and are you able to practice talking independently to your provider? If you do go alone, I think it is really great to be able to phone a friend. So maybe you go alone and you say to your, caregiver who usually has gone with you, hey, can you be available from 3 to 4 today in case we need to call you for additional information? And then call them and put them on speakerphone if you need that. Or if your doctor is giving you information and it's hard to digest all of it, that's another great time to phone a friend, have them get on the phone, and they can help you listen to it. And that's advice that I give people throughout their entire life, not just when they are at this age where they're starting to manage things independently. No matter what age you are, it can be really hard to take in all of the information and all the input that happens in a doctor's visit. Also logistically, just try to get there a little bit early. Parking is hard, especially if you're coming into Boston. Things don't always go as planned. Your doctor may be running perfectly on time, and if you're not able to be there in time, it can make your day a little more hectic and a little more difficult. So just for your own peace of mind, getting somewhere on time so that you can settle in and not feel frazzled and rushed. One of my favorite tips is to make a healthcare notebook. So like we just talked about with creating a medical history, that can go in a notebook, and it's a document that you can have with you throughout your medical journey. So we have a lot of people who access their notes through the Dana-Farber Patient Gateway, and that is an excellent resource. We also find that some of our patients see doctors who are not in the gateway. So there's a few things that you can do. You can keep a physical notebook, and in that notebook, you can put names of your doctors, your pertinent information, your allergies, your medications. You also, if you're a little bit tech savvy, within the Patient Gateway app, can add that information manually on your own. So there's a section that says My Profile. you can go into that and add information that you feel like you want other doctors to be able to know. So even if you go see, a doctor who has nothing to do with Dana-Farber and is not on the patient gateway, you can open up your gateway while you're in that visit and say, here's all of the stuff that I have that's part of my history. And you also can send access to your gateway to doctors who are outside of patient gateway. So if you have more questions about how to use the gateway and how to access it, the Dana-Farber website that I have listed down here, danafarber.org/patient-portals, has really valuable information about how to use the gateway and also a helpline that you can call for additional support. So we've gotten you to the doctor's appointment, and now you're there, you're parked, you're comfortable, you're ready to give your history. What can you talk about at the doctor's? And what I want to say is that doctors hear all kinds of things from all kinds of patients. They're trained to look at the whole body, and it's really natural to feel embarrassed or worried about talking about some things, especially if you're not used to talking about them. But I promise it's not something your doctor hasn't heard before. Um, Sometimes I hear from patients who worry about what will be written in their notes or whether their doctor will be overwhelmed by the things they say. I hear from a lot of patients who say they want to be a good patient and they want their doctor to think of them highly. And that's so normal and natural. We all feel that way, right? And it is okay to bring to your doctor these things that you're dealing with because that's what they're there for. That is their job, and they are there to help you, and they want to help you. So some of the things that you can bring, talking about specific symptoms that are bothering you, talking about your mental health if you're struggling with it, if you have questions about how to manage your physical health, talking about your sexual and reproductive health. And that's something that comes up a lot for young adults who maybe haven't had practice in talking about that before, is learning a language around that. If your sleep and your energy are not good, bring that to your doctor. If you're using substances and it's not working for you, another great space to bring to the doctor. You want to talk about your family history, let your doctor know what has happened in your life before and what you're bringing now. And if you're not sure if it's a thing to talk about at the doctor, talk about it. Because, like I said, we've heard it all. So just kind of some takeaways as you start to navigate the system is it's really important that you build a relationship with your healthcare team. And some of that is going to the doctor consistently and letting them know, this isn't working for me, or I have this question about this. They're there to help. And the more people that you get to know in your team, the more of a support system you're going to have around you. If there's something you don't understand, I want you to always ask questions about it, especially if it's medical terms or procedures. It is your right to be fully informed about anything going on with you medically. So the term that we use is informed consent. It is your right to have fully informed ability to consent to, talking to doctors, procedures, tests, any of that. So if you don't understand something, it's really important to tell your doctor, I don't understand this. A technique I really like to use is called teaching back. So if your doctor says you have high cholesterol, you could say to them, what I'm hearing is that I have high cholesterol. And really trying to put it back out there so that they can explain to you, this is what this means, right? So don't hesitate to seek clarification or additional information whenever you need it. Again, it is our job and our role to make sure that you have that information so that you can make decisions. A question I get a lot is about how much doctors can tell your parents. So once you turn 18, your medical information is private. That means that doctors, nurses, and other healthcare providers can't share your medical information with anyone else without your permission. And that includes your parents or guardians. So there are some things to know about. Often when you turn 18, you'll be given the chance to sign a release of information, or it's sometimes called a permission to share form. We have them here at the Farber. Every front desk has them. Any doctor is going to be able to connect you with a permission to share form. And what that is you providing consent for your doctor to speak with a person of your choice. And once you turn 18, we need to have you sign that so that we can be sure that we're allowed to talk to the people who you want us to talk to. And you always have power over, you can take that away at any point. And the other thing that you may hear talked about a good amount is a healthcare proxy form. This is a form that we encourage everybody to fill out, and that is to talk to give your doctor guidance of who they can talk to if you can't make decisions for yourself. So if you were for some reason incapacitated and you needed somebody to make decisions on your behalf, this form would say that this is a person who can make those decisions. And the role of it is to say that whoever that decision maker is making decisions that you would make for yourself. So if you do go ahead and have a healthcare proxy form signed, it's really important to talk to your healthcare proxy about the kind of decisions that you would want them to make on your behalf. And I will also add that you may have heard about guardianship and conservatorships. That's a somewhat of a separate issue. If you have heard that that's something that you would benefit from, that's a really good thing to bring back to your doctors and say, how do I start pursuing this? Typically, that's something that you would think about before you turn 18. And you usually work with a lawyer and a primary care provider to get connected. A guardian or a conservator is somebody who has the ability to make decisions and have your healthcare information once you're past the age of 18. Another big thing that I want to touch on is how do you access mental health support? A really good starting place is your primary care provider. They can be really valuable in helping address mental health concerns. We also have the psychosocial oncology team here at Dana-Farber. I am a member of that team. We have other social workers, psychologists, and psychiatrists on our team who can help address mental health. And then this is a bit of a shameless plug, but we have a video through the Blum Center that I also participated in about how to find a therapist, and has some very basic information about how to start your search for a mental health provider. So that may be helpful for you if that's an area that you're looking at support. So we hear a lot that people are pretty nervous about health insurance. And honestly, it's a tough thing to navigate. But let's dive into that a little bit and talk more. So getting insured. There are some typical ways that people get insured. The most common is people who are insured through employer-sponsored health insurance. So that's when you work a job, your employer may pay a portion of your health insurance. A lot of times it's referred to as commercial insurance, and usually you cost share with your employer around that. We also have the health insurance marketplace. So in Massachusetts, we call it the marketplace, and there are different health insurances that you can buy through that. And some of those are going to be different prices based on how much your income is. We also in Massachusetts have access to Mass Health, which is a Massachusetts version of Medicaid. And that is for folks who have lower income or who have other disability needs that may make them eligible for Medicaid. For Medicare, that is generally for people over 65 or additional disability needs. So those are all very kind of intricate. There's a lot more information about each of those things. But one of the things to know as a young adult is that if you are on your parents' health insurance plan, you can usually stay covered on that plan until you turn 26, even if you don't live with them. So if you need additional information about how to get insured, where I would start is either with the financial department here at the Farber or looking up the state exchanges, and they can help you to figure out what you're going to be eligible for and how to get connected with it. So once you have insurance, something important to know is that you will need to check and make sure that your providers are covered by your insurance. You need to do this when you see a new provider and when you change your insurances. So before seeing a new provider, you need to call your health insurance to make sure they're in network. And you can use this number. It's usually right about here on the back of your insurance card to call your insurance. If you are seeing a new doctor, you might want to ask them what their NPI number is, or National Provider Identifier, because that will help your insurance look that doctor up more quickly, and it might save you a little bit of a headache. If you are needing to find a new doctor and you don't have a list of doctors who are in your insurance, you can call your insurance company for that list, and they should be able to give you, here is who is in what specialty, here's who's taking patients. If you're having a very hard time finding a provider, so say you are looking for somebody with a very specific, niche skill set and you can't find one, you can also tell your insurance company that you're having a hard time finding that provider, and your insurance company needs to help you find that provider. That is part of their mandate from the government. So they may be able to give you more specialized lists. In some cases, they have case managers and folks at the insurance company who can help you with your search. So it's a really good place to call and say, what can you do to help me find this person? In some cases, your insurance company might even be able to make special arrangements for providers. So if you have a provider who is considered out of network, and there is nobody else who is in network, your insurance company may be able to help you connect with that provider or help cover parts of your cost. So it's important to ask your insurance company, what are your out of network benefits? Are there ways that they can help you? And the other thing that comes up a lot for folks is that even if you have a provider who's in network, you may have copays that are expensive and hard to pay. So you can ask your health insurance if they have any copay assistance programs that can help. So usually those are grant funded, and usually they can provide some assistance to folks who are having trouble paying their copays. So let's talk about what deductibles, copays, coinsurance, all of that is. So copays, coinsurance, and deductibles are types of out-of-pocket costs for healthcare. So what you physically will pay when you receive healthcare. And every health plan is going to be different. So even within, a company, two people may have different sets of benefits and copays based on what they elected when they chose to get that insurance. So I won't go into a ton of detail about these now because, like I said, they're very complicated. But a deductible basically is the amount that you pay every year out of your own pocket. So, for example, insurance may may have $1,000 deductible. So you pay $1,000, and after $1,000, your insurance starts paying. And that can be different. A copay is a fixed amount that you pay. So, for example, if every time that you see your primary care provider, your copay might be $25, whereas coinsurance is a percentage. So, if your primary care provider charges the insurance company $500 for a visit, with a copay, you'd be paying $25. With coinsurance, you would be paying 20% of that $500. So this is kind of more broken down example of if you had a medical bill for $10,000 and you had a deductible of $2,000, you would pay the first $2,000 out of pocket. Now, if you had coinsurance for that, you'd pay an additional $1,600 out of pocket. And then your insurance carrier would pay the remainder of the coinsurance. Now, that's a really big number. a lot of visits that you're going to have are going to be a lot less expensive than $10,000. So let's move on and we're going to talk about pharmacy and how to manage going to the pharmacy. I know that when I turned 18 and was young, this was one of the first things that really scared me about managing my own healthcare was what line do you stand in? Where do you go? How do you get the medication? Um, so big tip, most pharmacies, if you are having trouble covering your medication, they can help find reimbursement or copay assistance programs, just like we talked about for doctor's visits, copays. Um, and you can often ask your pharmacy to sync up your meds so that they all get picked up at the same time. Now, if you have a health savings account or so an HSA or an FSA through your employer, you can use this to pay copays. You can use this to pay for medication costs. And that can be a really helpful tip to use. And your pharmacy may have an app, which is also a great way to order refills and communicate with your pharmacist, especially if you don't live right next to the pharmacy and it's hard to go in, or maybe you're working and it's hard to leave work to go and get to the pharmacy. You may be able to do a lot of stuff through the app, and you might even be able to get your medications delivered to you. So it's a really good thing to look into. So let's talk about where else you can look for support. These are some general places that you may want to look. There are a lot of online support groups. There are a lot of places that are specifically for adolescents and young adults who are transitioning to adulthood. One of the ones that we really like is Stupid Cancer. They do a great job with creating a network of other people and doing webinars similar to this. The Blum Center has other webinars that are really helpful and useful. Lots of books on this. You can always come back to your treatment team and talk to us about, transitioning and things that, you may want some help or support or advice on. You can always check in with school counselors, with college centers. With volunteer organizations. I love the library as a resource. That is one of the best places to go for some of this stuff, because when they have all the books on this, but they also have people there who can help you to navigate some of the transition to adulthood. And then family and friends. If you have somebody who's been helping you manage your medical care, I want them to be your first line of a place to ask questions. So final tips and takeaways. Use a calendar. Like we talked about earlier, you may have appointments that are very far in the future. When you have those appointments, put them in your calendar. It can be an app, it can be on paper, whatever it takes to keep you organized. Create a medical notebook or some other sort of document that you can easily access that has your doctor's names, their contact information, something so you don't have to recreate the wheel every time. Download Patient Gateway. That is an excellent app. It has all of the information you can need. It gives you ability to talk to your doctors when you're not at visits, to send messages and to ask for refills. And a lot of the stuff that you need to do is all in there. And take it really slow. There isn't a rush for you to be able to do this all independently just because you are approaching 18, or you are 18 now. There is time and there are resources for you to learn it over time. And don't be afraid to ask for advice. Everyone is still learning no matter how old they are. So everyone has been through this at some point and is continuing to go through this. And I'm sure most people will be very happy to give you some advice and help you move forward. So let's stop and we have time for questions. If there is anybody who would like to ask questions, there's also my contact information in here. If you're watching this and you have additional questions after the fact, please send me an email. I would love to connect with you and I'd love to provide any clarity that I can.
Thank you so much, Becca, for that wonderful presentation on Adulting 101. To our audience, if you have any questions, as she mentioned, feel free to put them into the chat. But as I mentioned earlier, the session was recorded and it will be posted on our Blum YouTube playlist, so keep an eye out for that in the future. And thank you all for joining us today.